Hi, this is Ryan Bates doing a respiratory assessment. There's my patient, my guides, and 360 of the room. Hi, my name is Ryan Bates. I'll be performing a respiratory assessment on you today. How are you feeling?
I'm feeling good, thank you.
Thank you. We'll go over the steps. First, I'll start off by inspecting, and then I'll palpate, and then I'll percuss, and then I will, in the end, use my stethoscope. But to do this assessment, I will need you to remove your shirt. Is that okay?
Yeah, that's
Awesome.
fine.
I can provide you with a blanket, too, for warmth if you'd like.
Yes, please.
Okay. Go ahead and remove your shirt for me.
Thank you.
And then you can keep this in your lap.
Thank you.
Nice and warm. Okay. So first what I'm going to do is I'm going to go ahead and inspect. I'm looking at your rate, your rhythm, and the depth of your breathing. The whole time I'm just going to have you breathe normal, okay?
Okay.
I'm also looking, I don't see any deformities of your chest wall, neither on your front nor on your back. Have you had any shortness of breath lately?
I have not.
Have you ever had any trauma to your chest wall?
Nope.
Okay. Just keep on breathing normally for me. All right. Looking on your posterior of your back, I don't see any use of your intercostal muscles or intercostal retractions. And on your front, I don't see any subcostal. I don't see any intercostal. I don't see any supraclavicular. And I don't see any sternal retractions. That's good. I also don't note any cyanosis, no pallor. Everything is nice and pink and well perfused. Your capillary refill is less than 2 seconds. Everything looks good. I don't see any or hear any audible wheezing or any stridor. And I don't see any tracheal deviation. That would be a sign of attention pneumo. That's not good, but as a trauma etiologist. But yours is nice and normal in the midline. Next, I'm going to see, I don't palpate any chest wall deformities. Just no tenderness or pain where I palpate, is there?
Nope.
Awesome. All right, next I'm going to compare the front of your chest versus the side. I want to know that your front of your chest is about 2 and the side is 1. That's a normal anterior-posterior ratio. That means everything is in the right shape. That's good. Next, I'm going to look for any asymmetry or impaired respiratory movement. I don't see any asymmetry of your chest, neither on the anterior nor the posterior. Go ahead and inhale and exhale for me, and I'll check this, a big one for me. Okay, another big deep breath. All right, I don't know asymmetry or that. Next, what I'm going to do is I'm going to check for chest expansion. All right, so this is a different one. I'm going to kind of go ahead and feel. Please take a big deep breath for me. All right, I'm checking for asymmetry of your posterior. And then I'm going to come to the front and I'm going to put my hands on your chest with my thumbs out. And I'm going to feel for any asymmetrical movement, okay? So go ahead and take a big deep breath for me. Another one. All right, I don't feel any asymmetry. That's great. Next, what I'm going to do is we're going to perform tactile fremitus, and I'll start on the posterior. So we're going to go ahead and have you turn. All right, go ahead and just take nice deep breaths for me. Feeling for any extra vibrations as you take a breath in. I don't feel any, which is good. Go ahead and take a big one. Awesome. Let's go ahead and have you turn, and I'm going to perform this on the anterior side. Big deep breaths. Awesome. That's great. Next, what we're going to do is I'm going to percuss. This involves me taking my middle finger and tapping. What we want to hear is normal resonance. When I was doing the palpation, I didn't note any tactile fremitus, which is great. So I'm just going to lightly tap you like that. And what we want to hear is resonance. We don't want to hear any dull thudding. That one was a good one. Are you having any pain?
Nope.
Awesome. All right. Resonance to the posterior side, and then I'm going to do the same thing on the front. Okay, that's good. I still hear This one's going to be a funny one. Sorry, I'm trying to get
Yeah, okay.
Perfect. And then that's good. I didn't hear any dullness or any hyperresonance. That's a good sign. Next, what we're going to do is we're going to do the auscultation portion. So you just breathe normally. Don't worry about breathing when I put this on your chest or not. I'm going to be listening while you're breathing. Don't worry about breathing funny while we're doing it. So you just go ahead and take a nice deep breaths for me. Start at the top on the posterior side. Turn again. Check mid-axillary line. So posterior to mid-axillary, I noticed no adventitious breath sounds. You're clear and equal on both sides. That's awesome. All right, just keep on breathing for me. Okay, and then anteriorly, I noted no adventitious breath sounds, and they were clear and equal bilaterally on the anterior side.
Awesome.
All right. Last one is going to be a couple fun tests. First one's called bronchophony. I'm going to have you say the word 99 while I move my stethoscope around, okay?
All right.
And I'm going to be listening to see what that sounds like throughout all lung fields. All right, so when I set my stethoscope down, you just have to say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Awesome.
99. 99. 99. 99. 99. 99.
All right, that one was great. It sounded muffled and indistinct through all lung fields. That's a good sign. Next, we're going to do egophony. All you have to do is say the letter E. Just go E while I'm moving my stethoscope around, and we'll see what that sounds like, okay? All right, I'm going to begin.
E. 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 E.
All right, great. The normal finding on that is that it sounds more like the letter E than the letter A, and that's what we found, so that's great. Last one is going to be whispered pectriloquy. All you have to whisper is 1, 2, 3 as I move my stethoscope around, okay? We're looking for it to sound muffled and indistinct, but all you have to do is say 1, 2, 3. Begin.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
All right, awesome. That sounded muffled and indistinct throughout. The basis of listening to your lungs with this and doing all those different tests is to tell how well air is traveling in and out of your lungs and if there's any abnormalities. I didn't know any, so that's great. Thank you.
Yeah, thank you.